Hi, hello friends, hope you are doing well. My name is Deepthi. Today we will discuss about the important questions from adult respiratory system. Let's start. Pulmonary embolism is one of the most important topic we may get under respiratory system in adults. Let's discuss what is pulmonary embolism in detail, followed by the important questions. Pulmonary embolism occurs when a thrombus forms, most commonly in a deep vein, detaches, travels to the right side of the heart, and then lodges in a branch of pulmonary artery. Who all are prone to have this pulmonary embolism? Clients prone to pulmonary embolism are those at risk for deep vein thrombosis, including those with prolonged immobilization, surgery, obesity, pregnancy, heart failure, advanced age, or a history of thromboembolism. Fat emboli can occur as a complication following fracture of a long bone and can cause pulmonary emboli. Let's see the clinical manifestation of pulmonary embolism. What are the assessments do we find with the patient? Apprehension and restlessness. The client may experience a fear or anxiety along with restlessness. The sputum will be having a blood stain, chest pain, cough, crackles and wheezes on auscultation, cyanosis, distended neck veins, dyspnea accompanied by anginal and pleuritic pain, exacerbated by inspiration, feeling of impending doom, hypotension, fatigue over the chest and axilla, and shallow respirations. Tachypnea and tachycardia. These are the signs and symptoms that we can find during assessment with the patient of pulmonary embolism. Let's discuss the interventions that can be given for the patient with pulmonary embolism. Notify the rapid response team and primary healthcare provider. Reassure the client and elevate the head of the bed. Prepare to administer the oxygen. Obtain vital signs and check the lung sounds. Prepare to obtain an arterial blood gas ABG. Prepare for the administration of pairing therapy and other therapies. Document the event, interventions taken, and the client's response to the treatment. Move on to the questions which may come under the pulmonary embolism. Let's discuss our first question. A client in a postpartum unit complains of sudden sharp chest pain and dyspnea. The nurse notes that the client is tachycardic and the respiratory rate is elevated. The nurse suspects a pulmonary embolism. Which should be the initial nursing action? Here, the patient in the postpartum unit shows the signs and symptoms that will be correlated with the pulmonary embolism symptoms. What does the nurse must do on the basis of the priority? Let's see the options one by one. Option number 1, initiate an intravenous line. Assess the client's blood pressure. Third option, prepare to administer morphine sulfate. And the last option is administer oxygen 8 to 10 liters per minute by face mask. If pulmonary embolism is suspected, oxygen should be administered 8 to 10 liters per minute by face mask. The oxygen is used to decrease hypoxia. The client also is kept on bed rest with the head of the bed slightly elevated to reduce dyspnea. Morphine sulfate may be prescribed for the client, but this will not be an initial nursing action. Finally, an intravenous line will also be required and the vital signs need to be monitored, but these actions would follow the administration of oxygen. So, we can say the correct option is option number 4, that is administration of oxygen 8 to 10 liters per minute by face mask. Let's move on to the second question. A client has experienced pulmonary embolism. The nurse should assess for which symptom, which is most commonly reported. Let's see the options. Option number 1, hot flushed feeling, sudden chills and fever, chest pain that occurs suddenly, and the last option is dyspnea when deep breaths are taken. Here the nurse must know the symptoms that are commonly reported by the patients who are diagnosed with pulmonary embolism. Let's see what are those. The most common initial symptom in pulmonary embolism is chest pain that is sudden in onset. The next most commonly reported symptom is dyspnea, which is accompanied by an increased respiratory rate. Other typical symptoms of pulmonary embolism include apprehension and restlessness, that is anxiety or fear and restlessness, tachycardia, cough, and cyanosis. So, the most commonly reported symptom by the patients who are diagnosed with pulmonary embolism is chest pain that occurs suddenly. Let's see the third question. The nurse should report which assessment finding to the primary healthcare provider before initiating thrombolytic therapy in a client with pulmonary embolism. The options are option number 1, adventitious breath sounds, option number 2, temperature of 99.4 degree Fahrenheit or 37.4 degrees Celsius orally. Third point, blood pressure of 198 by 110 millimeter of mercury. And the last option, respiratory rate of 28 breaths per minute. Thrombolytic therapy is contraindicated in severe uncontrolled hypertension. It's because of the risk of cerebral hemorrhage. Therefore, the nurse should report the results of the blood pressure to the primary health care practitioner before initiating the therapy. So, the right answer is blood pressure of 198 by 110 millimeter of mercury. Here is the fourth question. The nurse is caring for a client who is on strict bed rest and creates a plan of care with goals related to the prevention of deep vein thrombosis and pulmonary embolism. Which nursing action is most helpful in preventing these disorders from developing? Let's see the options. Option number 1, restricting fluids. Option number 2, placing a pillow under the knees. Option number 3, encouraging active range of motion exercises. And the last option is applying a heating pad to the lower extremities. Here the nurse has to know the most important intervention in order to prevent deep vein thrombosis and pulmonary emboli for a patient who is on strict bed rest. So let's see the options one by one. Option number 1, restricting fluids. Keeping the client well hydrated is essential because dehydration predisposes to clotting. Hence, option number 1 is wrong. Let's see the second option. Placing a pillow under the knees. A pillow under the knee may cause venous stasis. So that also is a wrong answer. Let's move on to the third option. Encouraging active range of motion exercises. Clients at greatest risk for deep vein thrombosis and pulmonary emboli are immobilized clients. Basic preventive measures include early ambulation, leg elevation, active leg exercises, elastic stockings, and intermittent pneumatic cuff compression. Let's see the fourth option, applying a heating pad to the lower extremities. Heat should not be applied without a primary healthcare provider's prescription as it is contraindicated. So we can conclude the correct answer is encouraging active range of motion exercises. Let's move on to the fifth question. A client with a fat embolus is experiencing respiratory distress. The nurse plans to assist with which therapies? First option, administration of plasma expanders. low flow oxygen and suctioning. Second option, administration of bronchodilators, intubation and mechanical ventilation. Third option, administration of oxygen, intubation and mechanical ventilation with positive end respiratory pressure. And the last option is administration of antihypertensives, high flow oxygen and continuous positive airway pressure mask. Respiratory failure is the most common cause of death after fat embolus. The client may be intubated and mechanically ventilated with positive end respiratory pressure to treat the significant hypoxemia and pulmonary edema. The use of corticosteroids is controversial. When given, these agents are used to treat inflammatory lung reactions and control cerebral edema. Hence, the right answer is administration of oxygen, intubation and mechanical ventilation with positive end respiratory pressure. The remaining options are incorrect. Let's see the next question. A client being mechanically ventilated after experiencing a fat embolism is visibly anxious. What is the best nursing action? Option number 1. Ask a family member to stay with the client at all times. Option number 2. Encourage the client to sleep until arterial blood gas results improve. Option number 3. Ask the primary healthcare provider for a prescription for succinylcholine. Option number 4. Provide reassurance to the client and give small doses of morphine sulfate intravenously as prescribed. Here, the nurse must know what she should do for the patient who is mechanically ventilated due to fat embolism and the patient is anxious. So let's see the options one by one. Let's see the first option. Ask a family member to stay with the client at all the times. The nurse should speak to the client calmly and provide reassurance to the anxious client. The family members are also be stressed because of the condition, and it's not beneficial to ask the family to take on the burden of remaining with the client at all the times. So option number 1 is wrong. Let's see the second option. Encourage the client to sleep until arterial blood gas results improve. Encouraging the client to sleep until arterial blood gas results improve does nothing to reassure or help the client. Option number 3. Ask the primary healthcare provider for a prescription for succinylcholine. Succinylcholine is a neuromuscular blocker but has no anti-anxiety property. Hence, we cannot use succinylcholine for this patient. So, the option number 3 is wrong. Let's see option number 4. Provide reassurance to the client and give small doses of morphine sulfate intravenously as prescribed. Morphine sulfate often is prescribed for pain and anxiety in the client receiving mechanical ventilation. Hence, an anxious patient who is mechanically ventilated should be provided with morphine sulfate intravenously. So, our answer is fourth one. Alright, let's move on to the 7th question. The nurse is caring for a group of clients on the clinical nursing unit. The nurse interprets that which of these clients is at most risk for the development of pulmonary embolism. Let's see the options. A 25-year-old woman with diabetic ketoacidosis. A 65-year-old man out of bed one day after prostate recession. A 73-year-old woman who has just had pinning of a hip fracture. A 38-year-old man with pulmonary contusion sustained in an automobile crash. Clients frequently at risk for pulmonary embolism include those who are immobilized. This is especially true in immobilized post-operative client. Coming back to the question, in the options we can see one patient who is immobilized, a 73-year-old woman who has just had pinning of a hip fracture. Other causes include advancing age, hypercoagulability, and endothelial disease. The right answer is a 73-year-old woman who has just had a pinning of a hip fracture. Question number 8. A client is suspected of having a pulmonary embolus. The nurse assesses the client knowing that which is a common clinical manifestation of pulmonary embolism. Let's see the clinical manifestation of pulmonary embolism. In the option they say bradypnea. That is wrong. The patient will be having tachypnea. That is respiratory rate greater than the normal range. Next option bradycardia. No, the patient will be having tachycardia. That is increased heart rate than the normal range. Decreased respirations. That's also wrong. The patient will be having increased respiratory rate. Dyspnea. Yes, the patient will be having dyspnea. And also chest pain will be another clinical manifestations we can see from the patient condition. So here are the clinical manifestations once again. Tachypnea, tachycardia, dyspnea and chest pain. Coming back to the question, which is the most common clinical manifestation of pulmonary embolism? Yes, it is dyspnea. Hope you understand the question. Let's move on to the next question number 9. A client diagnosed with thrombophlebitis 1 day ago suddenly complains of chest pain and shortness of breath and is visibly anxious. Which complication should the nurse immediately assess the client for? Option number 1, pneumonia, pulmonary edema, pulmonary embolism and myocardial infarction. Pulmonary embolism is a life-threatening complication of deep vein thrombosis and thrombophlebitis. Chest pain is the most common symptom and it is sudden in onset and may be aggravated by breathing. The signs and symptoms include dyspnea, cough, diaphoresis is an excessive abnormal sweating and it tends to affect the entire body rather than a part of the body. And apprehension. Apprehension means fear and anxiety. These are the other symptoms that we can find. So, the most important complication that the nurse should immediately assess the client who is diagnosed with thrombophlebitis is pulmonary embolism. A client in the postpartum unit complains of sudden sharp chest pain. The client is tachycardic and the respiratory rate is increased. The primary healthcare provider diagnoses a pulmonary embolism. Which actions should the nurse plan to take? Select all that apply. Option number 1, administer oxygen. Second option, assess the blood pressure. Third option, start an intravenous line. Fourth one, prepare to administer warfarin sodium. Fifth option, prepare to administer morphine sulfate. And the last option is place the client on bed rest in a supine position. So what do they say in the options? First, administer oxygen. If a pulmonary embolism is suspected, oxygen is administered to decrease hypoxia. So, first option is right. Let's see the second option. Assess the blood pressure. We need to monitor vital signs and must be given importance to blood pressure, as hypotension is a concerning sign. Most likely represents cardiac failure secondary to right heart strain, especially in patients with massive pulmonary embolism. So, we can include the second option, that is assess the blood pressure under the right answer. Let's move on to the third option. Start an intravenous IV line. We need to maintain intravenous line as there is a chance of developing hypovolemia as well as oliguria. Hence, option number 3 is considered to be the right answer. Let's move on to the option number 4. Prepare to administer warfarin sodium. Warfarin sodium can be only given orally once in a day as a maintenance dose. It can only be given once the patient is stable, but not in sudden or acute condition. What can we administer is heparin therapy. So the fourth option, that is to prepare administer warfarin sodium, is a wrong choice. Let's move on to the fifth option. Prepare to administer morphine sulfate. Morphine sulfate may be prescribed for the client to reduce pain and apprehension. So morphine sulfate can be added to the correct option. Let's move on to the last option. Place the client on bed rest in supine position. Client should be given bed rest, but not in supine position. The head end should be elevated, which can help to reduce the dyspnea. The last option cannot be selected as the right answer. So the right options that can be taken for nursing care plan are the following. Administer oxygen, assess the blood pressure, start an intravenous line, and to prepare administer morphine sulfate. Hope you understand the questions so far we discussed. Please like, share and subscribe. See you soon with another video. Thank you.